Welcome back. Of course, here on the Morning Blend, we talk a lot about your health and how to keep yourself healthy. And today we're actually going to be talking about diabetes and how it actually affects your eyes. So I am coming all the way to Southwestern Eye Center with Dr. Diaz. Thank you so much for joining me today.
Thank you very much for coming.
So we're talking about diabetes today. Let's kind of just go over what diabetes is, and then we'll talk about how it affects the eyes.
Diabetes is a disease in which patients have an abnormal processing of glucose or sugars in the body, the bloodstream. So when we ingest or take in sugars, or as we call the most common form in our bloodstream, glucose, the body sends a signal to the organ, which is the pancreas, which produces insulin. So we all hear about insulin, which some diabetic patients have to inject. And this is the hormone that regulates the processing of glucose or sugar in the body. So there is an upset in the balance of either producing of the insulin or the signaling to the pancreas to release insulin.
And so how does that end up affecting our eyes or our eyesight?
Well, with diabetes, the glucose level is elevated. So instead of having a glucose level, for example, of 80 to 100, diabetic patients may have a glucose level of 300, 250, which is excessive. This excessive level of glucose then starts affecting the small blood vessels in the body, causing them to break down and become leaky. So these small blood vessels in the body are located in organs like the eyes, located in the kidneys. They affect your brain, your heart, your extremities, especially the feet. So as these small blood vessels break down, the vessels become leaky and these tissues become damaged.
And so if I'm someone that is affected with diabetes, would I necessarily have to come in more often for maybe an eye exam?
So the recommendations for diabetic eye exams are any adult or type 2 diabetics should see a doctor as soon as they're diagnosed, because they've usually had diabetes for a number of years before they've diagnosed, so they've had a few years for the damage to develop. Type 1 diabetic or children typically that are diagnosed with diabetes, the recommendation is to have an eye exam at least within 5 years of being diagnosed. But most doctors will send them a year or two after they've been diagnosed.
And we kind of hit on, even prior to being diagnosed, you may have been dealing with this. And so are there symptoms or anything that we could be dealing with that should say maybe I should come in more often or have my doctor, take a look at my eyesight?
Yes, increased blood sugar levels typically causes blurred vision. Mm-hmm. And it's a fluctuating blurred vision. So when the glucose is in a normal range, the vision clears up. If the patient ingests a big meal and the glucose goes higher, then they may notice a transient or blurring of the vision. So anybody that's experiencing blurry vision that comes and goes is a sign that should be looked into. But any effect on the eye can cause blurring of vision with the diabetes. So, but that's the first indication that somebody should get an exam.
And we're talking about the blurred vision and things that can happen once, you know that's something that you're dealing with. Is there any treatment that necessarily the eye doctor can help us with?
So the first thing, the most important thing in diabetics is to control the glucose. And we have very good medication. The primary care doctors are doing a great job of keeping the glucose under control with pills. Diet is a big form of treatment, controlling your diet, and exercise. Some patients have to go on to insulin if they're not controlled with the medication or diet. So that's the number one priority, because the only thing that's been proven to help prevent complications in the eyes and the rest of the body is to tightly control the glucose.
And so, of course, coming into the office, we'll be able to tell if, any of the sight that you're dealing with is due to the diabetes or something else that we would have to tackle.
Correct, correct. Yes, the eye exam that we do for diabetics is a complete eye exam. Some patients are familiar with eye exams that we get for glasses, for example, where they may just check your vision and check you for the need for glasses. And this is one type of eye exam. But the diabetic eye exam, we also check the pressure. We dilate the eyes, and by dilating the eyes, we can look in the back. And that's where we see most of the damage is in the retina in the back of the eyes. So if you're going to see a doctor for an eye exam, make sure that they dilate your eyes and look in the back. And once they do the dilated eye exam, then we can look for these changes in the retina.
Well, and of course, Southwestern Eye Center is a great place to come in order for that to be done.
Correct, yes. At Southwestern Eye Center, we do complete eye exam with dilation and look for diabetic changes, but also glaucoma, macular degeneration, and other diseases that may affect you.
Well, doctor, thank you so much for letting me come out here. I'm sure our viewers that are dealing with this are happy to hear that there's a place that they can come in and get that full eye exam done. So thank you again.
Thank you for coming.
And for even more information, call Southwestern Eye Center at 790-8888.